Our guest is Dr. Greg Rosenkrantz. Dr. Rosenkrantz is the CEO and the president of WVU Medicine Thomas Hospital. And it's a pleasure having you with us, Greg.
Thank you, Dr. Rashid. It's a pleasure to be here, and thank you for having me on your show.
In the past year, there have been two major changes in delivering medical care in the Charleston area, actually in the state, but here particularly. Now, one of these was the CAMC Vandalia Group, and the other was the WVU Thomas Hospitals Group. And you have been the CEO and the president of that latter group, the WVU Thomas Hospitals. And I worked at Thomas 52 years. When you came as a young man, I was working, and I saw this handsome, very intelligent young man be accepted for some higher post elsewhere. Major posts, and I think those things may have helped you juggle all of these problems you have inherited, so to speak. And he came back to West Virginia. So tell us briefly, well, let's go over it. You tell us about it. Have there been any challenges in these new systems? I have had patients who have said, I can't remember who my doctor is or where he is, and I personally had to go see one of my doctors yesterday. He was referred, and I went to the wrong building because he had more than one office. So what's going on?
So thank you again, Dr. Rashid, for having me on. But I think, I'm excited to be here. I'm excited about the future and what WVU Medicine Thomas looks like in the future as well as today. We celebrate our 1-year anniversary of being part of the WVU Medicine health system, which is the largest health system in the state of West Virginia. So I came back home. As you indicated.
And we thank you for that.
I came back home to help integrate WVU Medicine Thomas into the system. That consists of both the Thomas campus and the St. Francis campus. I came back from the Cleveland Clinic and my experience in integrating several hospitals into their system and being the chairman of the Medicine Institute in Cleveland for the clinic. So that experience, as you alluded to, Dr. Rashid, has really been beneficial for me and to manage the integration, to manage what healthcare, I believe, should look like for our patients. And I'm excited to be here and excited to be on the journey with our caregivers.
Well, you mentioned that the job with the clinic, the Cleveland Clinic, they have about 30,000 employees, as I remember, right?
Well, the current number is 81,000.
Oh, okay. So anyways, you learned a whole lot with some of these bigger organizations. Have the challenges you met in those other organizations helped you meet the challenges setting these systems up?
I think they're very similar. The scale may be slightly different, but the integration challenges are the same. I think there's always, and I use the statement with our teams, growth and comfort never coexist. So as we grow, as we change, there's always that fear, right? About the unknown, about the future, about changing from what you're comfortable with. So that's a piece of it. When we look at the challenges of integration, there's a couple pieces. It's the cultural change of that, and that takes one-on-one communication. It takes constant communication. It takes the right people in place to lead. I think number two is the IT integration. We talk about what is important to make us more efficient and to make us truly part of the system, whether they're the global business units such as Workday or Kronos to measure productivity and time cards, or whether it's the clinical record, which we'll institute in May 1 of this year called EPIC, which will allow us to communicate with all of the WVU Medicine hospitals and also with the Cleveland Clinic and every organization in the world that's actually on EPIC. So it's all of the above, but I think when you look at it, when it gets right down to it, whether it's a large organization, an intermediate sized, or where we are at Thomas is a community hospital being transformed, it gets down to the people. right? And it gets down to communication with each one of them on what's the why. Why are we doing this?
Well, in 1968, I chose Thomas as the hospital I wanted to work in because I was looking for a situation where my patients would be treated like family, because that's the way I treated them and that's what I considered. And so we did the very first eye surgery at Thomas, July the 5th, 1968. And we later brought modern cataract surgery to Thomas and the state later on in the 70s. But I can see where the staff of the hospitals, the staff of all your doctors, that's a whole lot of people that have to learn new systems and work with each other. And I don't know how you went about making that go very smoothly, but I'd like to hear about that.
So thank you, and I think it's a journey. So, I don't think it is finished. We're still in the process, but I think it's communication. It's acknowledging that it's difficult, right? It's hard work to change. It's hard work to learn new systems. But ultimately, the work that we put in today as a system and as people will make us more efficient and allow us to provide better care for our patients moving forward. And again, what's our why? Why are we here? Every Monday I talk to all of our new employees at their orientation, and I start with the why. Why do we exist? We exist to take care of our patients and their families and our communities.
And you do that every Monday morning?
Every Monday, and when I'm unavailable, which is a rarity, there is a tape of that. But yes, it's important that everybody understands why we exist.
That's very important. We even do that at the hotels with our staff.
Yep.
And go over everything. And, I roam around and I'll ask people who are there. They don't know who this old guy is. How is your stay? Is everything okay? And what you have brought up, I remember when I was in the hospital, and you knew it, and you and two of your staff came and visited me in the hospital. Now, I said, well, I'm a doctor, and Greg knows me, so he's coming here. But I also found out that you did that with other patients.
I make leadership rounds at least once a week. Walk around on the floors. We talk to our caregivers, we talk to patients, we talk to visitors and ask them what's working well, and also ask them what they think we should do better or differently. And I think we take that back and not just take it and look at it, we take it and act on it. And where we can, we make changes fairly quickly, and then we let the caregivers and the patients know what we've done to change that, and we monitor that over time. I think that's how you get better. Management by walking around as a leader, being visible, being engaged, being accessible to everyone, I think is really, really important.
Well, I was thrilled by your visit, and more thrilled when I found out you actually go around and talk to staff, and I watched you on the floor talking with them. And actually, when I was there, I talked to the other patients, and they seemed very, very pleased. And in fact, you've had a little bit of congratulations this morning from some of the staff here when they said something about their treatment at Thomas.
We've had really positive feedback from our patients. It's been really overwhelming. The changes that we've made that make it easier for patients, that make the access better. We always try to work to get better, and we will continue to do that. But we are seeing the progress, and I think more importantly than myself or my team seeing the progress, the patients are seeing the progress. And I think when you look at that, just when I look at the numbers from 2022 to 2023, we in the emergency room, we've seen 3,200 more patients in 2023 than 2022. We've done 1,100 more surgeries in 2023 than 2022, and we've seen 66,000 more outpatient visits in 2023 than 2022. So I think it shows. I think having access, having the right care at the right time, and having the right experience. It's all connected. And I think it's really important. And ultimately, the patients will be the judge of how that is.
Okay, now, I can recall when they started bringing in the computer systems, and actually that's one of the reasons I retired after 52 years. You had to spend so much time on the computer after a patient left, and I'm not computer based. In fact, I forgot my phone this morning. So I just said, this is just too much to do. But you have a system now, and I understand it took a while to get that integrated. But tell us about that system and how you communicate with WVU and all your other hospitals.
So our current system is Meditech. We're in the process of transitioning to Epic, and the training is ongoing with all of the staff and with all of our caregivers, including the physicians. We'll go live officially on May 1st of this year. We've been working on it for over a year. As you allude to, I think one of the burdens of electronic systems historically has been the input of the data by the clinician or the nurse, or putting in the items into the computer. We're working very hard to eliminate the number of clicks that someone would have to have. And we're also working very hard for those that have challenges with the electronic record to provide them with assistance, whether it's human assistance on a daily basis to input the data, or whether it's to create an environment where they can dictate directly into the computer without having to type. So I think those are important aspects, and as we move forward with our electronic system, it's something that we look at on a daily basis.
Well, that could change just on a per patient basis because the information isn't all the same.
That's correct.
I would assume that it's very costly.
The Epic system and the transition does have a cost, but ultimately over time you do recoup that cost with some of the efficiencies and what that looks like. And I think as a clinician myself, when you look at the ability to transfer and to look up data from other facilities, other physicians' offices, it really is a huge benefit to patients and clinicians in their offices overall. We all know what the paper record chase can be like, trying to hunt down records, and in this case, it makes it seamless.
Well, now tell us about the patient portal.
So the patient portal is called MyChart with Epic, and patients will be able to come in, they'll be able to look at their labs, they will be able to message their physicians or the offices with questions, whether it's about scheduling, billing, whether it's about a prescription refill or a clinical question.
Results of x-rays.
Results of x-rays should be pushed out, but if they're not and there's a question, they would be able to access their physician electronically, and we would call that in an asynchronous fashion, where you send in the email and you wait for the response, and the turnaround time should be within 24 to 48 hours, no more than that. But I think the portal also, as we look at that, we want to get into self-scheduling, much like you can schedule in a restaurant or a hotel, you can book your room. Ultimately, we want patients to be able to say, I'd like to see Dr. Rosenkrantz on Monday at 2. I see he has an opening. And if you're an established patient, to be able to go ahead and do that.
Are you seeing patients at all?
I haven't yet, but I will this quarter.
Okay, so you can keep in touch with the patients. That's going to make a big difference.
It does.
Yes, for the patients and for you. They will appreciate it. So this system, this Epic system, you can cope with any other hospital that's been on that system, and Morgantown, and this is...
We can communicate with any WVU Health System hospital within the state. We can communicate with Cleveland Clinic, with Johns Hopkins, with the Mayo Clinic, and actually any other facility. It's a little more difficult with non-Epic systems, but we can also import data from them as well.
Has WVU been supportive, or as supportive as you need?
You know, WVU Medicine has been incredibly supportive, not only of me personally, but of WVU Medicine Thomas Hospitals. They have poured in a significant amount of strategic capital over the last year that's allowed us to build our programs, to renovate our floors, to start our open heart program, to complete the St. Francis, comprehensive orthopedic hospital renovations. And so
yes,
the support has been incredible, and I couldn't have asked for more.
Well, that's interesting what you've opened up here. So what are the future strategic things that you have in mind or new things you're thinking about? Because I was going to mention that the St. Francis Orthopedic Hospital just opened last week.
So we have a number of strategic initiatives, but I'll start with the Comprehensive Orthopedic Hospital at our St. Francis campus. We did our first case on January 9th, and we are open and we're ramping up. We'll be doing about 50 cases a week by the beginning of February. The orthopedic physicians are rotating through there. We have, to complete the Gold Clinic, which is an additional clinic, we'll have outpatient physical therapy there as well. And the final completion, including the front entrance, will be in September, but we're currently operating there. The 7 ORs are opened up, the clinics are opened up, and it's been a great experience, not only for our patients, but our orthopedic physicians are very happy and very excited to be there. It's not just the facility and the OR. We've acquired and purchased 2 ROSA robotic machines for orthopedic surgeries. One is based at St. Francis. We maintain one at Thomas for emergency use. And that's an innovation. You know, orthopedic robotic surgery is an innovation that helps patients. There's quicker recovery times. There's more precise cuts, more precise surgery than history has allowed us. So we're real excited about that. The surgeons are excited about that. And most importantly, the patients have been very excited about that.
Yeah, they come and say, I want that robot surgery.
Many patients come and ask about the robot, and because they read about the ability to recover quicker and the more precise nature of the surgery.
Greg, you realize there are so many new things going on. It's amazing. It's hard to keep up. I once thought when I retired I was just going to keep up on all the new innovations, and it's just something else. And I was just at the St. Francis Hospital yesterday. I'm going to have some things done, and it's very advanced. I mean, they were on all 3 floors, but I was like, by 9 o'clock, I was already number 44 that had been worked in that morning. Amazing. It's amazing. So any other new things going on?
So we have a number of new things, and I'm excited to share them with you.
Please do.
And you know, this is over the last year. So we've opened up a brand new bed dialysis unit in the hospital for acute dialysis for our patients. We'll be completing a renovation for our 8-bed pediatric unit in mid-February and open up pediatrics again at Thomas.
Yes.
And so that is, we're really excited about that. We have it fully staffed and ready to go. They're training now on what that means, and really excited. In March, we will perform our first open heart case officially at WVU Medicine Thomas Hospitals. Dr. Nestor Dans has joined us, and we really, really look forward to that. We have opened up 3T, which is a medical surgery floor that had been closed down for a number of years. We've completely renovated half of it. Patients are already being seen there.
This is where, at the tower?
At Thomas in the tower.
Okay.
And the other half of that floor is currently being renovated, so that'll add an additional 24 beds to Thomas, and we need them given the patient demand and the volume that we see. We are adding a 3rd cath lab and a hybrid operating room as well at Thomas. And we have future plans for renovations of our emergency room and a new cancer center.
Well, those are amazing goals, and I'm sure there will be some challenges along the way, but at least you're on the way, and you've seen these changes in some of these major places where you've been before. And I think we talked about this before. One of the main reasons you came to take on these challenges because you wanted to come back to West Virginia.
Thank you for sharing that. And I, you know, when I came to the studios this morning, you know, I drove by the house where I grew up. I grew up about 2 blocks from where we sit today. Coming home, they say you can never come home again, but you certainly can.
Yep.
And I came back to give back and to help provide access to quality care for citizens of our community and our state, you know, because someone at some point will have to take care of of me and us and my family. And I want that to be available, and I want them to have access to that. And I don't want our citizens to have to leave the state for care because they think it's better somewhere else.
Leaving. Tell us about the helicopter port.
The helicopter port, it was new. It was built before I got there. It was fairly new. And we've actually seen, it gives us the capability both ways, obviously. If there's someone that we don't have the capacity to care for, we can send them to another WVU hospital system in Morgantown that can. But we've actually seen an influx of patients come in from multiple rural areas, some as far away as Pocahontas County, some as far away as Virginia, that are sent in to Thomas for care. Last evening, we actually had some patients that were from out of state that were driving to Thomas for their care. So I think the word's getting out. You know, we're going to care for our communities, we're going to care for the region, but we also want to be a regional referral center where we're recognized by patients and their families as providing high quality as well as compassionate care.
Where do you keep your helicopters? And how many do you have?
Well, we don't own any helicopters.
Oh,
We're
okay.
part of the HealthNet system. It's a
Okay.
shared service with WVU Health System as well as Vandalia Health CAMC and Marshall. So it's a shared service throughout the state.
Well, years ago, during Christmas, I was at CAMC, a general, and my room was near the landing. And all day and all night, I could hear these things landing. I didn't get much rest. So that's equipment. Let's talk about doctors. Are you looking for specialists, looking for new doctors? How does a doctor join your group? Are all the doctors in the group part of the group, or are some of them private? Tell us about your staff, your doctor staff.
So there's several different parts to that question, Dr. Rashid. So the medical staff is made up of both employed and private physicians, and we embrace both. I think if a physician wants to be a part of the system, certainly we'll entertain private practice and supporting them in that way, or a group that wants to add a physician, we'll certainly support them. If a physician would prefer an employment model, we're open to that as well. But I think it can be either one. We're constantly looking for talent, you know, on our medical staff. I'm happy to say that today is the first day we're adding 3 vascular surgeons to our staff today. They start and they've joined us, so very, very excited about that. We're constantly recruiting. We're recruiting all specialties. Certainly heart and vascular, we continue to recruit in that specialty to build out that service line. We continue to recruit in orthopedics. We also recruit, and we're focusing on a couple things. One is neurology and neurohospitalists, as well as ambulatory neurologists. There is a shortage of neurology, not only locally, but there's a shortage of neurology nationally. And so it's a competitive market, but we're very competitive, and we've interviewed a number of high-quality applicants from across the country here recently.
That's a tough specialty.
It's tough.
It's
tough. And primary care, I'm a primary care physician, so I don't want to leave out primary care, whether it's hospital-based as a hospitalist or whether it's true primary care in an ambulatory sense. We constantly recruit primary care because that's the backbone of our organization.
And so you're going to start doing that a little bit of yourself.
I am.
That's good, because that'll keep you on your toes, and you can find problems that way, but because somebody's not bringing them to you, you see the problem.
Well, I can experience them. Right?
That's it, yes.
And I think that makes a difference.
There's a shortage of doctors, particularly specialists, everywhere now. Are you finding reluctance for people to come to West Virginia?
You know, that was a question before I came back I asked myself, is how hard will it be? And to my surprise and delight, you know, I think it's been easier than people realize. I think the WVU brand helps to attract candidates to West Virginia. I think the lifestyle and the ability to live in a safe community that's supportive is important. I think the resources that a large system provides and WVU Thomas provides has made it easier than one might think. There are always challenges with having an individual relocate from, another
Yeah.
state or another area, whether or not it's West Virginia or even Florida. So having someone make a life move is always a challenge. But we've been up to the challenge, and it's easier than I thought it would be.
Well, we recently had one of your returnees who did an outstanding job, a urologist, and he came home, and it was very interesting. Several of us, I came back, I was exposed to Richmond and Cleveland and the service, but yet I always wanted to come back. I attribute that to having grown up in a little town called Montgomery, where everybody took care of each other. And that has always helped me with my communication with patients. I think they could tell off the bat that I love them, and I would take care of them just as I would my family. Now, there obviously are going to be some other problems. What are your major problems you see right now, immediate and in the future?
I think the issues that face healthcare and that we face at Thomas are staffing. I think attracting nurses, attracting and retaining nurses. We've done a really good job. Our floors are fully staffed at this point. But when you look at having someone come and be stable so you can develop those teams, I think that's really important. We're working really hard to solve that problem. But I think that's an issue facing healthcare as a general statement.
It's a major problem.
Issue. That would probably be front and center. I think long term, it's what does the financing of healthcare look like from a hospital and a physician practice organization. What does that look like? What should it look like? And those conversations take place at a higher level than the C-suite.
One major quick question. What do you see as the problems associated with Medicare and the federal government and medicine?
I think Medicare supports a lot of the healthcare industry. When we look at the payer mix here in West Virginia, it's a significant portion of that. It doesn't cover the cost of care, and I think that's the bottom line, that Medicare has to cover the cost of care that we provide.
And we'll leave it at that because that's a very important thing that all the people want to know about. Dr. Rosenkrantz, I want to thank you for telling us about WVU Thomas Hospitals and the changes that are going on. I see them on a daily basis. This is Dr. Richard C. Rashid, hoping you'll see a bright day.